Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Hafa day and welcome back to Healthy Living. Ovarian masses such as cysts and tumors are growths on or in the ovaries, the small reproductive organs located on each side of a female's uterus that store and release eggs and produce female hormones. Joining with me with more on this topic is ExpressCare's Dr. Jitka Lom. Hi, Dr.
Hi, Jolie.
Okay, so can you share with me, what exactly is a cyst on an ovary?
Okay. Well, you know, your ovaries sit down here in your pelvis. They're two small structures. They're the size of a large lime, or a very small, tiny little orange, big lime. And every month they produce follicles as you go through your menstrual cycle. Actually, it's kind of interesting. Little baby girls, when they're born, they have about 1 to 2 million follicles there. The little eggs ready to be formed later. By the time you're hitting puberty, you have 300,000–400,000 of those left, and then you go through your monthly cycles, and each month you will release one egg. Now, all the other eggs are used to produce follicles. Those follicles produce hormones. They produce our estrogen and our progesterone in our body. Sometimes what will happen is, as the follicle is forming, it'll create kind of like a bubble. And so the best way to think of a cyst is like a little bubble on that ovary. You can see them with an ultrasound. They're kind of clear. That's the most common kind.
Okay, now why does it happen?
Well, sometimes the hormones aren't perfect, and there's a little bit of an irregularity, and also in the way that the follicle is being formed. It should form and then release the egg. Sometimes it doesn't release the egg, and it just sort of stays stuck and keeps on growing. And the cysts can become very large. They can become as large as, you know, your palm, or even bigger. They can get really huge. Most of the time, they're little tiny ones, though, that you can just see with an ultrasound.
Okay. Now, is there a certain age that this normally, or this occurs more prevalently?
Ovarian cysts will form, follicular cysts form in normal women throughout our lifetime. So many times if you have an ultrasound, for whatever reason, they'll say, oh, there's little cysts on your ovaries, and that's normal. So right from puberty on through your reproductive years. After you hit menopause, you don't have that problem anymore. The problem with cysts occurs when they become large, and if they become painful, if they rupture, if they become twisted. These are the different things that can happen that then cause problems for women.
Okay, so are there any symptoms that occur to...
With regular follicular cysts that are, we call them physiological, meaning they're normal, there's no symptom at all. If they become large, you may start to feel pain down in the lower area of your abdomen. You may have bloating. You may also have irregularities in your menstrual cycle, especially if you form a lot of cysts, because the hormonal balance will be completely off. So irregular periods, heavy periods, these type of changes in the cycle.
Okay. Now, can you share with me, what is polycystic ovarian disease?
Right. So that is a condition where the ovaries actually produce way too many follicles at once, and the menstrual cycle is really, really irregular. So a woman may only have a period once every few months, once or twice a year even. And it goes along with certain other conditions. Polycystic ovary goes along with excess hair growth here. It goes along with obesity. It goes along with diabetes and cholesterol problems as well, high blood pressure. So it's like a syndrome. Basically, this is a condition that comes because of genetic factors and also because of obesity. Some women cannot control the genetic aspect, but certainly they should try to control the obesity aspect of their problem.
Can anything be done? What can be
done?
Yes,
polycystic ovary can be treated actually very effectively. One thing we do is put women on birth control pills. That way their ovaries take a rest. They don't have to be producing hormones, and they're taking them in pill form instead. So the ovary shrinks down. There are other medications that can be given to control the hormones that are formed by the brain that control the ovaries also. And then there are other medicines that we can use to regulate hormone balance, especially to control the hair growth. So there's a lot of hope. You can have regular periods. Of course, something like this would affect fertility too. So it's important for polycystic ovary to be controlled so that later the woman can bear children if she desires.
Okay. Now, can you share with me, what is the difference between fibroids, cysts, and tumors?
Oh, that's great. So a tumor just means a growth. A cyst is a growth, but it's a fluid-filled sac, meaning it's got a little shell and there's a bunch of liquid inside. Fibroids are growths that are solid. They're solid tumors, meaning a growth or a mass on the uterus. So ovarian cysts, we're talking about the two ovaries. Fibroids are muscle growths within the uterus. The uterus is formed of smooth muscle, and what can happen is that that muscle starts to overgrow in one area and make like a little ball and a little lump on the uterus. So when you feel inside or see it on an ultrasound, you can see that the uterus is very lumpy.
All right, thank you so much,
You're
Doc.
welcome.
Well, don't go anywhere. We are just getting started. When we return, the doc will take some of our viewers' questions.